Hi, my name is Wanda Young, and I'm going to be talking to you today in reference to preventing surgical site infection in our surgical population. What are surgical site infections, you might wonder? I'm going to give you what the CDC definition of surgical site infection is, and we will go from there. According to the CDC, a surgical site infection occurs within 30 days after a surgical procedure, and that could involve the skin or the subcutaneous tissue or the muscle layer. And this it could have purulent drainage coming from that incision, and the wound could possibly open spontaneously by itself, or if the surgeon thinks that there is signs of infection, he or she could deliberately reopen that wound. And signs of infection would include redness, hot, painful to touch. Patient might spike a fever. They could have pus coming from that incision. And if this happens, intervention must occur to help this patient out. Let's look at some of the facts about surgical site infection. According to some of the studies, about 500,000 people in the U.S. That go into surgery will incur a surgical site infection from their surgical procedure. And approximately 2 to 5% of these patients that are inpatient will end up with a surgical site infection as well. So when we have patients that's already in the hospital that are going for surgery, as the nurse, you need to make sure your patient is showered before surgery, whether it's using just regular soap or a antiseptic soap such as 2% chlorhexidine gluconate. And you want to make sure also that if they're coming from home, you're educating the patient on how to properly prepare before surgery as well. And surgical site infection account for 14 to 16% of all healthcare associated infections. What would be some of the risk factors for incurring a surgical site infection? Some of the risk factors would be whether a patient is elderly. When you have older patients, their immune system and their general health is not as good as the younger population, so they're more at risk for developing a surgical site infection. And whether the surgery is performed robotically or laparoscopically, that would increase their risk for developing surgical site infection as well. And how long the surgery is. Typically, longer surgeries, they are prone to having patients develop surgical site infection as well. So that is some of the risk factors. How can we help prevent surgical site infections? Well, the way we can do that is educating our patients, the ones that are coming through pre-admission testing, on doing a perioperative shower. And when they come through, you as a nurse should be explaining to them how to properly shower before surgery. You also should be using weight-based antibiotics prior to surgery, and those people that are in the surgical on the surgical team, they should not be wearing their scrubs in from home. There should be a policy in place that they must wear in regular street clothes into the hospital and change into clean surgical attire before going into the surgical suites. And of course, good hand hygiene is always important to prevent surgical site infections. Some of the nursing interventions we can do is when the patient comes into pre-admission testing, or if they're coming to their doctor's office, we can supply them with the 2% chlorhexidine gluconate body wash, or if they're going to be using the wipes, provide that to them as well, and give written and verbal instructions on how to use this. Patients should make sure they're taking a shower that night before surgery, sleeping on clean linen with clean pajamas, and when they get up the morning of surgery, taking another shower if they're using the soap, the liquid. If they're using the wipes, then they would take a shower, a regular shower that night before surgery, wait 2 hours, and then wipe themselves down according to instructions with the wipes. The next morning they would not shower, but they would just use the wipes again and wipe themselves down. The reason for that is we want 2 layers of that CHG on the skin. Studies have shown that multiple uses of this will have a higher concentration of this on the skin, therefore decreasing bacteria on the skin. In conclusion, it is important to to have patients shower prior to surgery according to studies, whether it's going to be just a plain shower or using the antiseptic soap. It's shown that it's decreased surgical site infections, and it also says studies show that multiple uses of CHG will decrease endogenous flora on the skin, therefore decreasing surgical site infections. And I thank you for your attention, and I hope you enjoyed this presentation. Have a good night.